everyone. Today on the channel, I have with me Brittany McGeary from Grow Physical Therapy, and she serves the families in Wichita, Kansas. Brittany, I'm so excited for you to share with the moms and parents of YouTube more about what you do, who you serve, and where you serve them.
Yeah, thank you for having me. I'm super excited too.
Will you tell the mamas out there who are in Kansas and they're like, oh my gosh, I feel like that's something that maybe my baby needs. What would you tell those families, and where exactly in Wichita do you see families?
Yeah, Wichita and then the surrounding areas, which we kind of have a lot. Goddard, Cheney, Garden Plain, Valley Center, Andover, Derby, kind of a lot of cities that are within 20 miles from us. Maybe that's good. Kansas, everything is pretty close. So I am mobile, which means I'll travel to patients' homes, treat primarily torticollis, which is neck tightness, and then plagiocephaly, which is flat spot on the back of the head. Usually I see both of them together. They're pretty common to have together. And then I'll also treat general delay and milestones. So any rolling, crawling, walking, anything like that.
Awesome. I treat a very similar population myself, and I love the little ones, and I'm sure you do too. For those mamas out there who aren't as familiar with plagiocephaly, I'm going to pop over to your Instagram and
Yeah.
show them a little bit of a before and after. And then will you kind of explain to us maybe what's going on, how that transformation happened? I know families love to see that, and you have some great content over there.
Yeah, thank you. Plagiocephaly, it's a flat spot on the back of the head. So that can be from being in utero, or it can develop kind of after birth if there's any asymmetries or postural preferences. If they have torticollis, which is the neck tightness, it can, because their heads are so soft, they can develop a flat spot pretty quickly. And even being like in utero, if they're a twin, so like a multiple, being male, low amniotic fluid, all that stuff can kind of contribute. And like I said, their skulls are just so soft. From like this picture, you can see there's flatness on like the back left side. So whenever we're kind of looking at that, you can see it kind of shifts the entire head shape. There's going to be less volume on the diagonal side, more volume on the opposites. You can see some changes in the forehead. Their ears may shift forward, eyes, and then also the jaw. So it's kind of involves a lot of things. So we really want to look at that. And then also, why is their head flat? If it's not from in utero, checking out to see if they have any asymmetries or tightness that typically is related from the torticollis, which usually presents with a head tilt to one side and rotation to the other.
Yeah, I think torticollis is such a diagnosis that families can do so much, especially if it's caught early, especially even before 3 months. I feel like this is an area for us as physical therapists where we can really educate physicians, pediatricians, families, parents, aunts and uncles, grandma, grandpa, everybody, because
Yes.
all these family members have touch points on little ones. And if you do notice a flat spot early on, they should be checking for that at birth. But even if, you're a month, 2 months out, seeking advanced and early care from a physical therapist, there are so many things you can do conservatively to influence that head shape, and it's a lot quicker.
Yes, the conservative part is so important because with like the changes we've made here, in order to change the head shape, it requires like prolonged positioning on a flat surface, and we do this with sleep. So when they're sleeping, we strategically position them in order to stay on kind of that bulge spot or the more voluminous side, which just holds the growth and lets the skull and head grow on those less voluminous side. The earlier the better, especially because We do this while swaddling. So once they start showing those signs of rolling, and this is, with or without plagio, anytime you swaddle, they show signs of rolling, that's when you start transitioning out. That's my biggest thing, is the education piece and kind of providing that to all parents, because we have such a tiny window of treatment when it comes to plagiocephaly. We'll treat torticollis, and they may present with it later as well. I have some kiddos, that's why they have asymmetries with crawling, so we can treat that later. But for that too, the earlier the better. They're not resisting the stretches as much, and we can just make a change a little bit quicker too, when they're younger.
I totally agree. And that is something too to just note for families out there, is that like I see kiddos who are toddlers, sometimes even kiddos who are older, who are struggling with stairs, and you find out that, oh, they skipped crawling, which is hands and knees crawling specifically. And then you find out, oh, maybe there was a little bit of positioning, and then you look at their trunk and you look at how the rest of them moves, and you realize that there's still tightness present. They could have had this tightness since birth. If a kiddo has no neurological diagnoses, but they're skipping or choosing different mobilities like booty scooting or hitch crawling where only one knee is on the ground, or only army crawling where just like their legs are flat and they're not on their knees at all, there's likely a reason underneath there orthopedically that isn't moving well, that is impeding them from their full potential. And I feel like this is an area where we could educate so heavily. I won't get on my soapbox today, Brittany, but that's something that I'm really passionate about. And I think it goes right along with what you're saying as far as torticollis. That could be one reason. And if it wasn't super significant, or if no one educated the families on it, it can show up further down the road in these other things.
Yes, exactly. That's just my biggest kind of point of that early intervention piece and providing the education. I'll have, some families that will come in, and it may have been brought up at, their pediatrician visit, and there's kind of this wait and see kind of when it comes to it. And with these specifically, it's not a wait and see. It's a let's go ahead and see why this is happening, and let's go ahead and let's tackle this right now before, especially with the flat spot, because depending on the severity, then if they need a helmet, and that was something that could have been prevented by positioning with sleep.
Yeah, and we have to think of life a lot of times as, a give and take and resources. And so sometimes the thought process behind wait and see is, hey, we don't want to over refer people to services maybe they won't need. And so we want to be conservative with that. But the thing that I think therapists get frustrated with is, hey, if you come to me, you may only need an evaluation or a visit or two if we see you early. So yes, you may pay a little bit of money for that transaction and for those couple of visits, but the take with that is, if you don't do that, if you do wait and see and it doesn't resolve, which I would say is a significant amount, don't fully resolve, or something is still there, then you're looking at multiple $1,000s for a helmet that may or may not be covered from insurance. And I love helmets, I really do. I think they're great. I think the position of the jaw and the ear are really important for overall health, and so that's something we really want to make sure is taken care of. But it is an added expense. And then also, if kiddos are older, it's not as easy to correct oftentimes, so it might take longer. And so waiting and seeing isn't always the thing that I think families are hoping it will be, right? Sometimes it costs more time, energy, effort, money, resources if we do wait than it would have if we were proactive.
Yes. And I don't know how it is there for you, but like in Kansas, for example, if they need a helmet and they go to, the helmet provider, they do all that. in Kansas, in order for insurance to even like consider covering, they have to have therapy for 2 months before.
Oh,
So
wow.
then they go, they think they're going to get a helmet, and then they're told, hey, if, and even then, sometimes insurance will still deny, but they require that as being a component of even considering paying, which is crazy. So then they wasted all this time, and then they're
Well,
told they need therapy 2 months.
and I think that that's like such a bureaucratic situation that like has such good intentions, right? Like, yes, we want to try the
Hmm.
conservative first, but the conservative happens at like 2 to 4 months.
Right, exactly.
After the age of 5 months, if you're rolling or showing any signs of rolling at all and you're out of swaddling, there's only so much we can do, and that's not necessarily on the head shape itself. And then if you then have, okay, so say you're 5 months and you're out of range of swaddling and repositioning, and you're like,
Hmm.
oh shoot, it's, it didn't change by itself magically. We go to
Right.
the helmet person, then they're like, okay, you need 2 months of physical therapy, which is good, and your
Yeah.
child probably does need those 2 months of physical therapy. But then you're not even getting into a helmet, so then you don't even go back to the helmet people until you're 7 months, and then it might take 30 days to actually get the helmet, so they're not even getting in a helmet, potentially 7, 8 months. And then
Right.
if you're not in a helmet by, really kind of that 5, 6, 6.5 range, it can take
Mhm.
longer too. So it's
Yeah.
kind of like this cycle where if you see, I guess the biggest thing we want Kansas mamas to know,
Yeah.
if you feel like your kiddo has any flatness at all, the person you want to call is Brittany at Grow Physical Therapy. Get an evaluation. She can
Mhm.
show you exactly what she's looking at. She can show you how your baby moves and whether there's any increased risk factors with that torticollis that might make that flat spot get worse or at the very least not get better. She can teach you those strategic sleep positions, and all of a sudden, okay, hey, we're in a good spot. Because I also think one thing we don't talk about is, as far as like resources, the wait and see approach, there is so much of an emotional cost with that with families. Like,
Oh, yeah.
of all the mamas who are like, oh my gosh, I wish I would have, Googled for you sooner. I wish I wouldn't have taken that advice
Mhm.
to wait and see.
Right.
The amount I learned in this hour with you taught me so much more, put all of my fears at bay. I understand
Yeah.
now why my child is presenting this way. I have a game plan for how to influence it. I'm not just like waking up at 2 o'clock in the morning Googling,
Right.
like, is this something I did? Because I do think when mamas
Oh,
hear
yeah, that
stuff
guilt.
about in utero positioning, like, they're like, am
Mhm.
I responsible for this change in my baby's head shape? Do you hear that from mamas too, Brittany?
Yeah, I'll have some that are like that definitely are feel guilty about it, and you absolutely should not. Like, there's nothing you can do, and like there's nothing you can change from being positioned in utero, like we'll address it when baby's born and we'll tackle it there and we'll be good. So I think, yeah, I would say like a big thing for us, like pediatric physical therapists, is just you will never feel guilty or regret having an eval done. Even and everything's fine. Even if everything's fine, you'll never say, "Oh, I should not." I mean, I've never had someone say that. Like
Yeah.
most of the time they're just so thankful to be like have that relief and know that nothing, no major concerns, or they're feeling relief that they're on the books and they have a plan and they're ready to get some answers finally and be provided with that education. So, yeah.
And I don't know if you get this with your mamas, but some of those little babies, I think, especially first time moms, they're just like soaking up like how I'm holding and moving the baby,
Mhm.
and like how I'm trying to engage the baby in rotating their head, or trying to like feel things, how I'm talking to the baby. And
Mhm.
sometimes it's not even fully what you thought you were going to get out of an evaluation that you value
Yeah.
the most.
Oh, yeah, for sure. And just like hearing, whatever concern they have be, and then that can take you somewhere else, but we're still providing that education. And even if it's something minimal, or yeah, what we didn't expect to go into, the like relief and like the mom guilt that goes away, it's so nice. And it's fun that we can be there for moms to help with that.
I love it too. And I know you go into the house like I go into the house, and I'm curious
Yes.
about like your experience with the mamas, because this is something that is becoming more common. It's obviously something that I'm obsessed with and super passionate about, because
Yeah.
I have an entire playlist like having
Yes.
interviews with amazing humans who are bringing this type of physical therapy to
Mhm.
mamas and dads too. I have a lot of dads who
Yes.
are either working from home or stay-at-home dad, and are present for physical therapy. What do you feel like is different? Like, have you ever worked in a clinic before? Can you speak to the difference in just the experience with the parents and the kiddo being in the home with you?
I also work part-time in a school district, but I love going to the homes. Like, you see what their day in and day out is. You see what toys they have, what equipment they have, where they sleep. And then you can make those changes or provide all of that education with stuff they already have in the home. Like, you don't have to make
Mhm.
them go out and buy anything. You can set up their environment to be beneficial in ways that you wouldn't think of. So, like, the way they are in the crib, in order, if they're having a preference with looking in one direction, well, are mom and dad on this side, or are they sleeping on this side? Are they in the room by themselves? Like, there are so many different things, and just being there also allows for those questions to come up, because if go to an office, you don't always think of those things until you see it. And so it's just so nice. And then, I mean, a lot of my parents have siblings too, so
Mhm.
they're not having to load the baby up. Most of the time I'll walk in and they'll be like, "I'm so sorry, the house is dirty," or whatever. And I'm like, that is like, I don't even notice that at this point. That's like the most common thing they say. But then they're just chilling and we're just hanging out, sitting on the floor, and like it's comfortable. So I
Mhm.
love it. I love going to the homes and just making it easier, I feel like.
Yeah. I love how, I mean, even if you have siblings, like parents might not feel, they might not feel like it's calm. But to me as a therapist, compared to like being in a big clinic with lots of kids and lots of equipment
Yeah.
and lots of other therapists, it's honestly a lot gentler of an experience for me, even. And so I can only
Yes.
imagine it being a gentler experience for the baby or the toddler or the child. um, I feel like it takes less work for me to be like to be almost like a part of the family, for the kiddo to warm up, for the
Mhm.
kiddo to trust me. Mom can just breastfeed if she needs to calm a child
Right.
down. Like, if mom's in her pajamas, I don't care. If mom makes
Yeah.
coffee and is drinking it on the couch while she's watching what I'm doing, and I'm chatting with her and she's
Mhm.
chatting with me, like I feel like that is something that, it's just such a unique, almost elevated experience. And I don't want it to come
Yeah.
off like not we're like knocking clinics at all, but it's just a different, calmer, more gentle experience
Yeah.
that is just different, and that might be better for your child, and or a clinic could be better for your child, but the important thing is that it exists and it is available for
Yes.
you if you need it.
Yes. Yeah, it's so much more personal. And I feel like like I can connect really well with families, and like, yeah, we're going to their homes, and that's like someone's kind of like their private space, or that's part of their family, and so they're welcoming you into their home. And yeah, I love it. I love being mobile.
I do too. I do too. I don't know if I could ever go back, honestly. Say there's a mom out there, right? And she's in Wichita, Kansas, and she's like, okay, I need a physical therapist. My kiddo has diagnosed torticollis, or they're kind of just hanging out like this all the time. Maybe they're even like their trunk is all bent to the same side. And so we're really cattywampus. And they're like, okay, I come to Grow Physical Therapy and I see that Brittany comes to the house and I am sold. I'm like, all right, I am so ready for this. Let's head over to your website, and could you just walk us through, like, what would that mama do in order to touch base with you or schedule with you?
Yeah.
How does that all work?
So I believe at the bottom of my homepage, there's like a little box where you can type in if you kind of just have general questions. Maybe you're not ready to book, or you want to kind of figure it out. You can type your info there. I'll get your email. I can contact you from there. If you are pretty certain you know what's going on, or you just want an eval, you can, at the top, there's I believe it's top right on the desktop. On phone, you'll just hit like the little lines for the menu. There's a book now tab, and it takes you to my scheduling system. So you'll just click, schedule initial evaluation, and it should just pull up my live schedule, and you can go directly and book from there. And it'll email me, and then it'll automatically email you the intake forms you'll need, and it's all online. And then I'll just show up at your door when you schedule.
Can I just say, I love so much that you have everything like automated online. I don't know about the moms in Wichita, Kansas, but I personally cannot handle calling someone and then doing like the back and forth, like, oh, on this day at this time of this, oh, that doesn't work. Okay. No, like, all I want to do in life is sign on to a website and be able to see someone's opening, look at my Google, calendar, pull it up and be like, no, that one matches. All right, let's do this. Done. Right?
Yeah. I mean, I haven't booked an appointment myself through my website, but for the most part, everyone has said it's pretty seamless. Like, I'm pretty sure you can log in with like your Google or Facebook or whatever. If you want to, you can make your own login. But yeah, everything's right there. And I mean, it's super convenient for me too as a provider, because I mean, we're seeing patients all the time. So it's just me. Like, I'm not on my phone. If I have a missed call, of course, I'll call a patient back. But for the most part, they'll just book through my website or email or text. And it's just so simple.
Well, and I agree. So, and that is something that, like, I feel like a lot of solo physical therapists like may not have been able to do even like 10 years ago, because for the mamas out there, a lot of clinics have like a front office person, they have a clinic manager, they have someone who does the billing for them, and then they have the therapist that your kiddos see. And so for, us to just be able to bring high quality physical therapy right to you, and also to make the experience seamless, that is a testament to 2022 and beyond, that we're all so grateful for.
Oh yeah, it's so, I mean, I really like it. I'm assuming patients do too, but yeah, you literally can just click a few times and appointments booked and good to go.
Can I also just say that I'm obsessed with your website? I know I've told you this a million times before.
Yes, you're so sweet. I know my hair's like super brown in it.
So one thing I love talking about is money, because I feel like it's something that is needed to be more transparent in the healthcare space. And I really feel like us as solo practice owners are really taking charge and being really honest about our charges, about how we collect money and what that money goes towards. So I would love to talk a little bit about that with you. I know when we go to book online, you're super price transparent. Obviously, just no disclaimer for everyone that these are the prices at time of recording, and Brittany reserves the right to change her prices at any time. Right now, an initial evaluation at $125, you know, accept all of these forms of payment, but could you just walk us through in your own words just how you see the payment process with families and how that works, and a little bit more about this like out of network concept?
Yeah. So I'll do cash pay or out of network, which out of network basically just means I'm not participating with an insurance provider. I say this and I think others feel the same. As healthcare providers, we don't like to be told that we can't see a patient or they're not going to cover based on like a specific diagnosis, or they don't see the reason. And then come to find out insurance isn't going to cover. Then you have this huge back bill. So it's just way easier. I can provide a super bill if you want to check for out of network rates and see if they will reimburse. But for the most part, I'm just pretty transparent. Either way, I require the payment at the end of the visit. You know, you have to, for me specifically, you have to have a card on file, but before, I'll just make sure that's the right card you want to use. I'll send you an email afterwards, but yeah, I would say maybe 15% of my caseload will get a super bill, but a lot of them will just do the cash pay. It's simpler, and depending on like deductibles, like they're rising to crazy amounts anyway. So it works out for me. And I think for the parents, just kind of me coming out, here's a set visit and here's the price and we're good to go.
Yeah, and I agree. So I'm same. So I also am out of network, and I think one of the big things that my families say about this whole process that might be similar for your families too is just that I don't have to worry about getting any big surprises. Like, I
Right.
know that it is like that flat rate. I'm never going to be charged more if, you know, we need to cancel visits in adequate amount of time per cancellation policy. Like, there's no charges for that. I know I can budget it. It's not necessarily going to change every single visit, because what a lot of parents might not know is there's this amount of reimbursement based on what a provider charges as far as like the codes go. And so sometimes the
Right.
reimbursement or the payment to the provider can change. And so you might get a bill that looks kind of funky because it's not an even cut for every visit. And I feel like a lot of my families are really grateful. It's like, hey, like, I know it's X amount per visit. If I see you 4 times that month, I'm able to budget that within. And hey, if I do submit a super bill, say maybe, you know, I have a low deductible and I get out of network benefits. So say I have like a $500 deductible and I meet that in like, you know, 2 months or 1 month or whatever, then I submit these and insurance just cuts me a check for, you know, 50, 80%, 60% maybe of that amount. After I meet my deductible, I just look at that as kind of like bonus money. I think the transparency and just not having to worry about any random bills coming out is something to say. And I will also say that there's a myth out there that insurance-based in-network physical therapy is cheaper than out-of-network physical therapy. And oftentimes that's not the case, because you're going to have an in-network deductible too. And you're going to have to pay 100% of your physical therapy visits or a copay or some kind of combination of that until you meet that deductible. And then you might still be responsible for a percentage of those visits. And oftentimes those visits from an in-network perspective are $250 kind of plus per visit. And so you can be responsible for more. I actually had a family who had twins, and it was like $600-$800 a session for both of them from the
Oh
hospital
my
base. She's
goodness.
like, it was insane. Now insurance paid some of that, but she's like,
Right.
well, I go to you and it's like a quarter, 10%, I don't even know, right?
Yeah.
Of
Oh my
that.
goodness, that's crazy.
And she's like, I've learned so much more from you because you're coming into the home. We're having an hour-long conversations while you're juggling my child and doing all
Right.
of these other things at the
Yeah.
same time. Right?
Oh
So
my goodness. Yeah.
I
And I
think,
feel like too, with being like a cash pay, granted, I would never be any different if I was in an outpatient clinic, but I want to work so much harder and like provide so much for you because I know this is an out of pocket expense for you. And like, I want you to have the best experience and like as much education as you need. Like, I'm working for you, and I understand that's not for everyone to do the cash pay because it can be expensive. And so I am like, I feel like working extra hard because I want to make sure we're doing all that we can.
oh yeah. And I'm like always trying to be really mindful of the parent's investment in me. And if it feels like, oh, hey, we can, taper down visits, I'm really comfortable with that. I think this is good. I have that conversation right away.
Hmm.
And then based on the family's comfort level, we transition. I'm sure that's really similar to you and your
Yeah.
experience as well.
Yeah. Yep. And if there's like any concern initially too about expenses, then yeah, we can, depending on what it looks like, the severity, but I can try to teach you even more, and we'll like touch base and maybe be spaced out a little bit. So it's every other week or whatever, like super flexible depending on the case, but um, being more transparent about it, it just helps so much.
I agree. I love, love,
Hmm.
love that you also have virtual consults. So maybe someone was like on YouTube searching torticollis stuff and this, interview pops up and they're like, dang it. I'm not in Wichita, Kansas, but I just kind of fell in love with Brittany. Her Instagram's amazing. I love her
Yeah.
website. I would love to just like get her, professional opinion on my kiddo's like head shape or just some
Yeah.
general information on torticollis because she just seems like a person that I could have a, 45-minute conversation with. And I would just like love to, pick her brain, learn from her.
Yes.
Tell me about these virtual consults.
So that is, if being out of state, it's like an educational kind of concept. So still providing helpful information depending on what it may look like. I can help position. I'll still kind of do the same thing, looking at like head shape or like torticollis, of course, still giving that like general education and setup, or like some things that I'll tell everyone with like one-sided handling, making sure you're switching sides, holding babe, switching sides, they're placed in the crib, just to help prevent any of those asymmetries, kind of along the lines of that. And yeah, just doing some pictures and positioning as needed for that.
I think this is something that's really needed because we really need to just have more availability, not necessarily in like having like being available 24/7, but being more open to having more access points to people. Sometimes people don't know if their kiddo even needs physical therapy, but then
Right.
they connect with someone through some online medium, whether it's Instagram or YouTube or whatnot. Hey, can I just speak with you for,
Right.
30, 45, 60 minutes? And would you help me figure out what my next step should be? Do you
Yeah.
know of anyone in this area that I could connect to?
Right.
What would I Google to find a person that could help me with this,
Mm-hmm.
right? Sometimes it's literally just having our brains attached
Yeah.
to our fingers so that we can Google for them what they're looking for, and we can teach them how to Google or how to find appropriate resources for the questions that they have.
Yes. Oh yeah. Yeah, for sure. That's a really great way to put it. There's so many things we can help with that aspect as well.
And I see you have a free guide up here too. Can you tell
I
us a little more
do.
about that?
Yeah, so it just kind of gives an overview of what torticollis and plagiocephaly are, some like helpful tips to try to avoid a flat spot, and then also some things you may look for or you may notice in your little one if they do have torticollis, which a lot of it is the asymmetry or single sided preferences. So only looking in one direction, only reaching in one direction, prefers to feed from one side, kind of all of that. And then my favorite, it has it on there, but my favorite little tip is checking your camera roll, because
Mhm.
take a lot of pictures of your little one and you may not notice it in a moment, but if you kind of scroll through, I'll have some, they'll be like, man, I was looking at the photos and they're only looking that same side in all the photos. And that's kind of a really easy indicator to see, like, yeah, maybe they do have a preference, or maybe they are only looking in one direction for most of their day. So that's one of my favorite tips to kind of do. Just look through that camera roll and see.
There is so much that we can learn from ourselves. I mean, I even notice that like I always kind of like hold my head or like hold my body in
Yes.
certain ways when I'm posing too. Our body remembers
Yeah.
our comfortable positions, right? So we want to make sure
Yep.
we're breaking that pattern as early as possible.
Yes. Yes. Exactly.
Awesome, Brittany. Well, I loved our chat. Is there anything else you want to tell the mamas of Wichita, Kansas, or anything we didn't cover on your website that you want us to go through?
I think just the kind of general thing we hit earlier, if you have concerns or if you have a question, just go ahead and reach out. We can't provide specific advice via like over email or messaging, but if you do have like a concern and you're wondering if this is even anything to worry about, just like shoot me a message, because we want to get the little ones treated as early as possible to help decrease costs and the amount of visits. And like I said, they're a lot easier to treat when they're young and they don't have all that head control, and we can make the changes in their head shape. So just if you have any kind of mom gut feeling or you just really have a question, don't hesitate to reach out.
I love it. I think that's such sage advice. I am behind you 100% with that.
Well, thank you. I appreciate it.
Awesome, Brittany. Well, thank you for coming on the channel and sharing with the mamas of YouTube all about your services and how you can help support their babies in Kansas.
Yes, thank you.